So welcome to week three. We're going to be talking about population health and practice issues. What we know is that there's been a dramatic increase in life expectancy for Americans during the 1900s, from less than 50 years of age in 1900 to about 77.9 years in the year 2007. We credit this dramatic increase primarily to improvements in sanitation through the control of infectious disease, particularly vaccinations, as well as other public health activities. What we do know is that the Public Health Service estimates that medical treatment can only prevent about 10% of all early deaths, but we do know that population-focused public health has the potential to prevent approximately 70% of early deaths in the United States through measures that are targeted on the factors that contribute those deaths. And the Institute of Medicine report in 2012 actually has given us significant focus on funding for public health services and an emphasis on population-based prevention, which actually goes hand in hand with the Affordable Care Act. There are some specific ethical concepts which guide population health focus, and we did discuss this last time. We want to do the greatest good for the greatest number of people. We want to make sure that we're treating people fairly and distributing our resources and as well as burdens equitably among all members of society, and then ensuring that our vulnerable groups are included in this equitable distribution of resources. The Affordable Care Act has given us significant benefits for public health and also given us a significant focus on public health nursing because we do see more people who are insured. We see a shift from direct clinical services in the public health agencies to more population health, and then this allows for public health agencies to refocus on community population focus, promotion, and prevention activities. And what I mean from that is that in the past, a lot of our public health agencies had to focus specifically on treatment for TB or treatment for well baby care and those kinds of activities. And now we're seeing insurance payments and payouts for those kinds of activities in primary care in the United States, as opposed to those dollars having to go to direct clinical services. And so now we can actually see those monies going to education and other interventions at a much larger scale. So public health is defined as what we as a society actually do together to assure the conditions in which people can be healthy. The Institute of Medicine has done a lot of work in promoting public health and population health. And so, as you can see, this version is from 1988, and we have 2012. We have a number of other IOM reports that actually focus on the priorities for public health. So we have to, public health is basically giving us the importance of, giving us the understanding and the importance of how do we ensure that people in our populations are healthy. And that is a specific governmental role. And to clarify that role, Institute of Medicine actually states that assessment, policy development, and assurance are the key public health core functions for all levels of government. We're going to talk to them specifically in the upcoming slides, but the definition of assessment is the systematic collection of data on the population, the monitoring of the population's health status, and the making of information available about the health of the community to all. Policy development refers to the need to provide leadership in developing policies that support the health of the population, including the use of scientific knowledge in making decisions about policy. And assurance is defined as the role of public health in ensuring that essential community-oriented health services are available. And so this does involve providing essential personal health services for those who would not otherwise receive them. This also refers to making sure that a competent public health and personal health care workforce is available. And this also means that public health officials should be involved in developing and monitoring the quality of services provided. So keep those definitions in mind as we also think about prevention, primary, secondary, and tertiary, and how that works in population health. So public health in America, we have a very specific vision. We want healthy people in healthy communities. And we want to do that through the promotion of physical and mental health and the prevention of disease, injury, and disability. And we do that through those essential services of assessment, policy development, and assurance, which again, we'll be talking about in just a minute. Public health nursing is considered a specialty because it is population focused and community oriented with a health and preventive foci, so that we're not looking at caring for individuals with diabetes or on the med surg floor, but we're looking at health and prevention. So, and in addition, our interventions are not individual in focus, but they are looking at community or population levels, while with the biggest concern being for the health of all members of the population or community, and in particular, those of vulnerable subpopulations. Public health nursing has a distinct focus, a distinct scope of practice, and does require a special knowledge base. The primary emphasis is on the population whose members are free living in the community, as opposed to those who are institutionalized. Community oriented means that there is a concern for the connection between the health status of the population and environment in which that population lives. This environment could be the physical, biological, or sociocultural environment, and that there is an imperative for public health agents to work with the members of the community to carry out any core public health functions. And the health and preventive focus specific is for strategies on health promotion, health maintenance, and disease prevention, in particular primary and secondary. We know that interventions are community level or population levels, and we use the political mechanisms to ensure that intervention strategies are available to affect public policy and achieve the goals. And again, the concern is for health of all members of the population or community, and in particular, vulnerable subpopulations. So again, assessment. It's the systematic collection of data on the population. We want to figure out what's going on with the health status, not of an individual, but of everyone within the community, geographic region, cultural group, social group, community, whatever you have defined that community as being. And then we also want to make that information available so that not just healthcare providers, but other people in the community understand what's going on. And so assessment also looks at the diagnosis and investigation of health problems, again, not for the individual with diabetes, but say for all of the persons within a community who may have diabetes, or all of the people who may be exposed to E. coli, or all of the people who may be exposed to an injury threat. So the public health nurse, when they are working in the assessment activities, they're often participating in and providing leadership for the assessment of community needs, identifying the health status of those populations, and then looking at the environmental behavioral risks that go along with those. Public health nurses are looking at trends in the health determinants. So that might be sociocultural issues. It might be what's going on with, remember the video we watched last week, health determinants. So is that biopsycho or social issues? Identifying what the priority health needs are. These health needs may actually change over time and is dependent on a lot of different things. Consider our vaccination levels and risks that are coming up. Public health nurses are often involved in evaluating the adequacy of existing resources and then looking at policy development. And so helping to inform others about that. And so assessment it's kind of a dual role in that we're looking at identifying policy development efforts because we need to understand and assess the need for those efforts. And so that then builds into policy development. So policy development, referring to the need to provide leadership in developing policies in support of the health of the population. So what we're trying to do is inform, educate, and empower those individuals, such as assemblymen or the legislature or our elected officials, and give them the information that they need, um, help educate them about the needs of the population, and then help them identify the tools that will then promote policies that support that health. So, for example, let's talk about this new initiative about getting rid of plastic bags. Uh, the city has decided that that's an important piece, and then that's going to be a goal because a lot of times we think about the issue of plastic bags because we're talking about climate change. And so this is one step that we can take so that we're not polluting our landfills and that we're not utilizing oil and to, make all these plastic bags so that we're then becoming a little bit more green, decreasing our carbon footprint. And so a lot of times what nurses might be doing is, sitting there and talking with the assembly about helping them understand how climate change and the carbon footprint actually impact the health of our populations. Public health nurses are often a great liaison between community agencies and community groups to help partner and mobilize those groups. And then also, again, bringing the scientific knowledge base, nursing, core public health information to those policies and plans to support efforts to promote health change. So this is definitely a core function and a core intervention strategy, seeking to build constituencies for change in public policy, whether that's at the local, state, or national level. Public health nurses have been involved in the Healthy People 2020 state objectives. If you have not yet looked at the Healthy Alaskans 2020, it's certainly something to look at. There is a national effort, particularly by public health nurses, in control of HIV and AIDS. And then public health nurses have been highly involved in anti-smoking ordinances. And that's really about nurses then speaking to public health departments, speaking to legislatures, assemblies, universities. There's a public health core group that actually participated in the anti-tobacco campaign here on campus and participated in development of the tobacco policy here at UAA. And so, because what they did is they were out there trying to look at changing the policy on campus around use of tobacco. Assurance is another role of public health. And the goal is that essential community-oriented health services will be available. This may include the provision of personal health services for those who might not otherwise have them. So think about our STD and family planning clinic. Individuals who don't have access to insurance because of their age or income need to have those essential public health services available. And so that may be one thing that the assurance activities fall under. It's also making sure that individuals who work in public health and in personal health care are competent. And so that's making sure that those services are effective, they're accessible, and are of quality, that research is being conducted in public health issues, and assurance also means that our public health officials, including nurses, are developing and monitoring the quality of services that are out there and provided. Assurance activities are also part of the enforcement of laws and regulations that protect our health and safety. And again, assuring competency in public health workforce is absolutely essential. And so they may be doing research on how to ensure that public health nurses understand all of the roles for HIV and AIDS and provide training so that um, public health nurses are teaching others about HIV and AIDS, that they're doing appropriate screening, and that they understand all of the pieces behind it so that when they're doing education with individuals, communities, or policymakers, that they're providing research and evidence-based information to those groups. So again, the public health nurse may be doing activities like I was just talking about with HIV, that we are meeting public health goals and plans. That public health nurse might be partnering between public and private agencies. That might be private funders. It could be public grant funding. It could be participating between school districts and the health department to ensure that vaccinations are happening. And then also promoting knowledge and behaviors that support and improve public health. We talked about this already, and we know that prevention, not every event is going to be preventable, but every event does have a preventable component. And so nurses who are working with prevention really have an opportunity to meet full on community levels. So they're reaching a large percentage of people. They're helping to affect change. They're helping to promote awareness and commitment, not just by individuals and changing their diet, but also by talking to policy developers and changing tobacco ordinances, right? That we're promoting awareness of the risk of tobacco, firsthand, secondhand, and thirdhand smoke, right? And what those risks are, and helping understand why those are risky, and then helping to promote a commitment to a tobacco-free community. So prevention programs also help increase the cost efficiency of other primary care measures, and hopefully what we're doing is evaluating the effectiveness of all of those. So public health has some very specific core functions. So not only are we doing looking at the assessment and assurance and policy development, but we're also looking at population-based programs that support the goals of our clinical preventive services, right? So we're focusing on disease prevention, health promotion and protection, as well as the primary, secondary, and tertiary healthcare services. What we know is that the greater the effectiveness of services, such as at the population-based healthcare level, the greater it is for the higher tiers to contribute efficiently to health improvement. So what that means is the better we do with promoting education and awareness about tobacco or alcohol or vaccination, the better the services are at the primary and secondary, even tertiary healthcare levels, because we're going to see a decrease in chronic disease or measles because we have vaccination. So we do this, and a lot of times people talk about community-based nursing or public health nursing, and basically the difference is they're both community specific. Okay, the difference is that public health nurses are population focused, okay, and their emphasis is on the free living population, as opposed to a community health nurse. That could be any or all nurses that are practicing in the community. And often the community health nurse is providing direct personal services, not necessarily population focused strategies, but more along the lines of working in the client's home or within the clinic environment. So what I say to people is when you're thinking about population health versus community health, think about where services are actually provided. So if the So let's look at it this way. Most community health nurses and many staff public health nurses, okay, in the past and even up to today, have a focus on providing direct personal care services to people or family units. They're not necessarily within an institutional setting like the hospital or the nursing home, but they're still a specific focus on community oriented or community health. The difference being that if you're specializing in public health or population health, you are specifically focusing on free living clients in the community, and that represents the individual, that represents the box A. Okay. If you're looking at a specialization in community health, you could be looking at box A and B. Okay. So boxes C and D actually represent those institutional populations. These are those nurses who provide direct care to those specific individuals in those specific types of setting. So the difference is population focused public health specialization are clients living in the community, and you have that larger focus. Community health is typically individual or family focused, and these are clients who are still living in the community, but they're not a larger population focus. There are some significant challenges that we see in the future because there are actually barriers to understanding public health nursing. And a lot of people feel that nursing or recognize that nursing is only at the bedside, quote unquote, right? And so part of what we do with public health and population health is look at changing that mindset that there is a role for nursing outside of the bedside, outside of the hospital. There's a different work structure with public health nursing. There's a different role socialization. You know, that we're talking, these are typically Monday through Friday, 9 to 5 jobs. You know, they're not focused on that 24-hour, 7-day a week, 365 days a year, hospital type of role. And so there's a different way of looking at how the work is structured and how you as a nurse would be socialized in that role. Um, some of the other barriers to specializing is that not a lot of nurses actually get graduate level public health nursing education. And there's not a lot of programs specific to public health nursing at the graduate level, but there is like public health master's degree or doctoral programs. And so it can be a lot harder to get a graduate level for that. Um, some of the other barriers are nurse leaders who have a population focus as opposed to nurse leaders who um, are, you know, leading the way in critical care or med surg or OB care, um, and so as opposed to population health. And the other challenges are also, you know, shifts in public policy. You know, sometimes our policies and the goals of the country itself don't have as clear of a focus on prevention and population as they do at other times. And so we always have to see where do we as public health nurses fit into that. Part of what public health does is gives us a different perspective that sees that health behaviors are definitely influenced beyond that individual person. And in the past, when we looked at lifestyle improvement, we really looked at um, helping, you know, Joe or Susie stop smoking or decrease their drinking. But we want to look beyond that, look beyond what's happening with that individual. So an example would be that adolescent who decides not to smoke. They're deciding not to smoke because they have multiple different kinds of factors and multiple different influences, right? So maybe they have they have a positive self-image, and so they see themselves as a successful individual who does not smoke. That's an individual attribute. Um, Teenagers who have a strong parent-child connectedness have definite family influences that help promote their non-smoking. If the aggregate for example, their peers or other teenagers or their school have a focus on not smoking, then often those teens will then take on that attribute. And but there are also community factors. So if you have teens in a community and that community is in a place where, say, Anchorage, where we're focused on a tobacco-free workplace, tobacco-free recreation sites, and facilities, um, our community is influencing all of our individuals to be non-smokers. But what if we actually lived in a tobacco growing region? There'd be a lot of community factors that would then influence people to be smoking because it influences, right, the economic success. So what we know is that when we're looking at interventions to initiate or even maintain healthy behaviors, we know there's a greater potential for success when we direct those interventions towards multiple targets, not just one-on-one with the individual, but also looking at families, groups, communities, and society. And for example, that's where the socioeconomic ecological model for health comes into play. And we recognize that um, when we're looking at this greater um, direction with multiple targets, we know that health promotion is more effective then. We also know that promotion can be more effective when it's focused on improving quality of life rather than a focus on just stopping smoking, right? So when we're talking about, if you stop smoking, you can exercise better and you can get out and you don't have smells on your clothes and your babies aren't being exposed. That's an improvement in quality of life rather than just don't smoke because it turns your lungs black. Um, and again, we know it's much more effective when we focus on multiple targets at the same time in a very systematic manner. So we know that nurses are familiar with the nursing process, particularly as it applies to the individually focused nursing care. And when we use that same process, assessment, diagnosis, planning, intervention, and evaluation, when we use that at the community level, it's the same process and we're doing it the same way. It's the same phases. They're just no longer at the individual level. We're now looking at the larger partnership or the larger community and really focusing on what's happening. Who is it? Where are they? Who are they? Right? So we're going to talk about that. So our assessment starts with awareness of the issue, access to the issue, availability of services, affordability of the promotion that we're asking them to take on. Is it acceptable? Is it appropriate? Is it adequate? We can't do anything unless we're looking at these kinds of topics and making sure that people are aware. So like, let's look at a anti-smoking campaign. We have to make sure that people are aware. We have to make sure that there's access to smoking cessation materials, right? So there's access and available, that they're affordable, and that it's acceptable to, one, use those materials as well as stopping smoking. Are they appropriate to the population that you're trying to put that, gear that towards? So are the materials or um, even the products, the cessation products, appropriate to the cultural group or the ethnic group? And are they adequate to meet the needs? Do you have enough? Um, do they work? Right? Did anybody do that research? Or is this just something that somebody says, well, cranberries decrease your inflammation, so if you have arthritis, you should eat cranberries? Well, we don't know that that's truly research based. So that may not be an adequate answer to arthritis, but are the materials for smoking cessation, are they adequate to meet the needs and the understanding of the people who are using them? When you're doing your assessment and you are obtaining all of this analysis, I'm sorry, all of this data about your project. And so for you guys, you're all doing projects on summertime safety. You have to actually analyze that. You need to look at what's the census, who lives where you're looking to promote this event, what kind of demographics are out there. And then you need to make sure your data is organized. You need to look at quality of life and mortality data related to your issue. How many people are dying from animal attacks? How many people are drowning? How many people are, getting injured in bicycle or mountain biking activities or trail activities? And then identify what's in our community that makes these activities assets, but what's in the community that makes it a challenge to promote that health. Um, or promote the changes that we're trying to identify. And then, of course, you have to prioritize what you're going to focus on. A lot of times, so this little slide starts with follow the model you have chosen. I actually wish that was at the bottom of this, because when you look at a theory or a model and you're trying to identify how to move forward with your assessment and your analysis and then developing a plan to meet the needs, the model can help you do all of those pieces. And so let's look at an example. Um, this is one of my favorite. I use this quite often in the work that I do. Um, you guys are probably all, I think we've talked about the fact that I'm a forensic nurse and my goal is working on interpersonal violence prevention. That's not just DV or sexual assault, but different kinds of violence across the lifespan. And so um, for many years, I looked at the sociological model just by itself, because recognizing that, there's not any one level that we should be doing education or intervention for, right? Can't just talk to individuals, but need to look at their families and their peers and people in the community and the leaders, society changes. And so, I've always used that, but it was always missing a little piece. And so McKee, Manoncourt, Chin, and Carnegie, they actually brought in knowledge, attitudes, beliefs, and skills, as well as norms into this sociological model. And they help identify the cross-cutting factors that are important, right? You have to be able to provide not just individuals, but um, neighbors and communities and leaders with information and knowledge, and then that helps them develop the attitudes and beliefs and the motivation um, to make a change, as well as provide them with skills and access so that they can act, while at the same time you're looking at altering the perceived sociocultural or gender norms that impact that topic. Not every topic is going to have those issues, but it's likely that you're going to find some aspect of it. That does not mean that you have to use the SEMC for your model or theory for your project. You could be using the health belief model. But again, you have to come back and look at how does the model then help you build your intervention, help you build your evaluation, and do all those other pieces. So, and we can talk about that more if you have additional questions, but I think it'll start making sense as we move into week 4. A nursing diagnosis is really important because it helps you clarify, right? And it helps you take all of the data that you had, all of that analysis that you pulled forward, and it gives you a first step in planning. And it really does clarify who you're targeting and what's the problem, and then helps you clarify how to actually start to help the community solve that problem. Okay, so let's look at the anti-smoking. Your nursing diagnosis might be increased readiness for enhanced knowledge regarding the issues of tobacco. Um, it may be that your community does not have that as an issue. When you did your assessment, you may find that 90% of people who live in Anchorage um, agree with not smoking. So maybe what you're having to do is then prioritize what's going on with that 10% of the people who are not smoking. So the population health, we're still looking at the ADPI process, the nursing process, right? Assessment and diagnosis. And um, you have to plan for that intervention or implementation. You analyze and establish the priorities, right? And then you clarify that through the development of the nursing diagnosis. And that then gives you a goal and an objective to work towards. And then when you understand what your goals and your objectives are, then you can identify what activities are going to actually help you accomplish that. So if your goal is to decrease the percentage of smokers in Anchorage that you identified as, readiness for increased awareness of stopping smoking. I'm making this up as I go. So if you're trying to focus on the 10% of the population who still smokes, and that's a made up number, okay, but 10% of the Anchorage population continues to smoke, right? So your nursing diagnosis might be readiness for enhanced knowledge on quitting smoking, right? But the goal is going to be not that Anchorage is needing to understand it, but that the smoking population of Anchorage. So your goal might be to decrease the percentage of Anchoragites who still smoke from 10% to 5%. Okay. And then your objectives would be those individual steps that you're taking to make that happen. And so it might be focusing on, whatever, um, focusing on educational materials that are available at uh, places where they can actually buy cigarettes. It might be talking to policymakers about increasing the tax on tobacco, right? To make it so that it's even less comfortable to purchase because it's even more expensive, right? So those kinds of activities. So you might have to get in there and talk to people at the assembly because they need to know that yes, 10% of the Anchorage population is still smoking and we want to decrease that to 5%. This is why, because it's no longer first-hand smoke, but now it's second and third hand. And what are the dangers of those, right? It might be activities to do PSAs about third-hand smoke and share the research that's actually out there. And then so you actually have to enact that plan. And so how are you going to make that happen? How are you going to get that information and knowledge out there? And then you have to be able to evaluate it, right? Because evaluation is going to tell you whether or not you were successful at decreasing the percentage from 10% to 5%. So what if you only decreased it to 8%, right? Is the community satisfied with that outcome, or do they want to continue to work on that and look at it in additional ways? Or did the percentage go from 10 to 12%, right? Something was wrong with the materials. So when you are the fun part, or I guess for me, because I'm a nerd, is about implementing that educational plan is that you actually, as the public health nurses who are doing these programs, you have control over this starting, sustaining, and stopping. You have control over every method and strategy, and so that you can ensure that they are initiated, maintained, and ended effectively in an appropriate time and manner, right? You're able to your educational plans when as a public health nurse you're coordinating and controlling all of the factors, right? So like where you have it, the flow of the presentation, all the other pieces of the program that need to be put out there so that your target audience is understanding. And it's your job to make sure that the materials are still related to your core theme and your goals. So you would want to be careful that your materials aren't suddenly going off and talking about opiate use, you want to keep them logically related. Your focus is on decreasing the percentage of Anchoragites who still smoke from 10% to 5%. So you want to make sure that you're looking at logical and thematic information, because it may be that you're not trying to focus on those individuals who are the first time stoppers, right? These may not be people who have never, I mean, everybody's heard about the importance of stopping smoking. You're probably likely looking at this core group of individuals who are having difficulty stopping. So you may actually need to be looking at how do we help this, even help this more challenged population attend to this goal. So you have to be able to evaluate what you've done. Okay, so you have to look at what happened with your um, educational activity or the intervention that you put into place. And so we want to know what that's going to look like from the very beginning when you actually start looking at the goals and objectives. Um, and so that's going to help us figure out whether or not the costs in not just money, but also time are worth the resulting benefits. So, and then what are the outcomes? I mean, if you find that now the number of people who are smoking in Anchorage is now 12%, that means something happened in our campaign, and maybe we actually made smoking look more exciting in our campaign, and so people are actually smoking, starting to smoke or resuming their smoking as opposed to um, more people quitting, which was our original goal. So we have to figure out why is that happening. So program evaluation does a number of things. It tells us, did we meet our goals? It tells us, were we accountable for the monies that we actually spent or the resources? Did our program fulfill its purpose? Was the program, was it good? I mean, did it actually, not only did it fulfill its purpose, but was it accessible? Was it reliable? Did people in the community actually, did it appeal to them? Because maybe it only appealed to certain segments of the population as opposed to appealing to multiple segments, right? So evaluation helps us justify whether we should keep the program going in the future, or do we need to make changes? Do we need to make it bigger, or do we need to make it smaller? Or do we need to stop it and because it's not working, right? Maybe we shouldn't continue to do that. Um, And part of how you're going to do that is you're going to look at the stakeholders. You've got to be able to talk to them and have them help you describe your program. And then they also will help you focus how you want to do the evaluation. They'll help you gather credible evidence. And then, but part of the job that you're going to do is you're going to justify the conclusions that you made, and you're going to make sure you use and share the lessons that you've learned. So, for example, we're going to talk about um, evaluating our project on decreasing smoking from 10% to 5%, right? So the number of people who still smoke in Anchorage, we want to decrease, if 10% are still smoking, we want to decrease that to 5%, right? We want to talk to the stakeholders. Who is important in the smoking population? Is it the people who sell tobacco? Is it doctors? Is it health clinics? Is it restaurant places? I mean, those kinds of things. Who is important in that? That also needs to include the people who smoke, right? And we have to be able to, as the program designers, we have to be able to describe what it was we did, right? And then we use that. Being able to describe the program helps us focus how we're going to design the evaluation. And by that, it means, are you going to survey people? Are you going to do focus groups? Are you going to do questions? Are you going to simply monitor the number of cigarettes that are actually purchased in a year and compare that from year one to year two? And that's where you're gathering that credible evidence. Um, are you just simply talking to people and getting self-reports? Are you actually looking at hard data? And when you pull all of those pieces together, it then helps you justify the conclusions. And then it's your job to make sure that you've shared that evidence, again, back to stakeholders. Are you sharing it with the people in the community? Are you sharing it with doctors? Are you sharing it with other public health officials? Because are you sharing it back to policymakers? Because they may want to fund or not fund you for the future. So you'll get that information, like I said, through observations, through interventions, through interviews, through program records, through looking at demographics, looking at everything from mortality data, to how many people are dying from smoking related illnesses, to, the number of cigarettes that are actually purchased. And the whole point for this is it's going to help you identify what it is that you need to do. Is your program relevant? Is it needed? Did the program address the extent of the need? Was the activities of the program, were they able to be tracked? So did we see step-by-step progress being made? Was it efficient? Was the resources spent or utilized positive? Did you meet the program objectives and the program efforts? Did you have a short-term or long-term change in the population? And sustainability. Are there enough resources there to continue the program? So if we look at that again at decreasing rates of smoking, why is it needed? Okay, well, we know that smoking is bad for your health, so we want to decrease smoking-related illnesses. Did the program adequately address the need to decrease, right? Did it actually meet the requirements? Was it a good program, right? Did it meet the needs for the population itself? Was it in the right language? Was it at the appropriate literacy level? Did it actually address the topics that it was supposed to? Were you able to see change over time? Were you able to track where you were from before you implemented the program to after? Were you able to track how efficient your program was? I mean, did you spend $40,000 on a media campaign and saw a gain? Or did you spend $10,000 on a media campaign and actually saw a decrease in the number of smokers, right? That would definitely show efficiency and effectiveness, right? What kind of impact did it have? Are you measuring and evaluating not just at the time of the event, but in 3 months or 6 months or a year or 2 years? How long were you able to ensure that those long-term changes took place? And is it sustainable? Were there enough resources to continue the program? If you only get $10,000 and you know you're not going to get any money next year, how are you going to be able to continue the program, right? If it's a positive program and you want it to continue, how are you going to do that? How do you propose to identify the resources you need to continue it? So you're not just evaluating the program itself, but you're also evaluating the educational process, because you need to be able to make decisions on how to improve the program itself. So whether that's education or in prevention, majority of the work you're going to do is on education. So you need to ensure that there's feedback to the educator, right? So that they can modify the teaching process and better meet the learner's needs. We also need to be able to evaluate the components of the program. Are the goals and objectives being met? How long is it taking for individuals to meet that achievement? Is the desired health behavior change really necessary? You might have to rethink about the practicality and merit of each of your objectives. So let's say, for example, we're doing our health fair and let's use my zebra analogy, right? So is our goal of decreasing zebra injury actually effective, right? Is it really necessary? Is it practical in this grand scheme of things? Or should we be looking at something else? Another example is, let's say it takes you 30 minutes to talk to one person about zebra safety because you're spending all your time talking about why zebras are unsafe when we don't actually have zebras here. So it's taking you that much time to talk to one person. That's a significant issue. And so we might have to look at how are we providing that information transfer? How long is it taking? And is it even meeting um, our needs? Because remember, is it relevant? Is it adequate? Are we making progress? Is it efficient? Is it effective? Is it making an impact? Is it sustainable? And if you the tobacco analogy may be more difficult, but if you think about zebras, do we need zebra safety, right? Um, if we do need zebra safety, is the program addressing our issues of zebras, right? Are we able to track how people are actually um, meeting the program objectives for zebra safety, right? Is it efficient? Are we using our resources appropriately? Are we able to make long-term changes? And is it sustainable? So we can measure the outcomes of our educational process both qualitatively and quantitatively, right? How well does our learner understand the content and how much of it does the learner retain? So it's going to be important that you are actually looking at this part. So you're going to be doing an evaluation of your project, right? And so you might ask a qualitative um, question or you might ask a quantitative, right? You might be looking at how you're going to identify that. So you might be looking at questionnaires or rating scales, surveys, checklists. You might want to do a skill demonstration, right? You might want to do a test. You might want to just get subjective feedback, or maybe you want to directly observe people mastering materials. So it all depends on how you're doing your education. If you're doing, um, face-to-face discussion, you might want to do like a rating scale. Did you understand it, right? If you're going to do kinesthetic activities, right, you might want to do a skills demonstration. So you have to think about the kind of methods and tools you're using to teach, and then what kind of methods and tools are you going to use to measure your outcomes? And are you trying to measure a knowledge or skill or ability? Are you measuring attitude or behavior? Are you measuring health status or quality of life? And um, ideally, we'd be looking at long-term evaluation. For the purposes of your guys' project, you have to look at short-term. You're looking at what did you learn today? And you want to find out, 50% or more people understand that, zebra safety is a significant issue in the city of Anchorage, right? Um, or 100% of people identified that they weren't aware that zebra safety was an issue in the state of Alaska, and they have identified new ways of um, being safe. So, um, we talk a lot about all different kinds of things, and one of the things that we talk about is evidence-based practice. And evidence-based practice is just as essential in um, population health as it is in um, any other kind of nursing. And so it doesn't mean we throw everything else out. It means that we integrate evidence or research with our clinical expertise, both of ourselves and others. but also with client preferences and values, and which is really important because this is part of why we're talking to patients about what do they want to learn, how do they want to know, how do they want to get from one level to the next, and what has worked in the past to share this. And so we might want to use specific research, right? Hardcore gold standard systematic reviews and meta-analyses to figure out what this is. And I know you guys have all had research, but so this is just one way of finding evidence to support what it is that we're doing. We have to make sure that whatever evidence that we are using is that we've evaluated it and ensured that it is has some strength, right? Is there good quality? If we're using research, did we look at the number of studies, the magnitude, and the sample size? And is the design appropriate? Is it consistent? Or are we simply looking at the current status of our own practice? And we do know that a lot of times what we do and the caring, the doing, the caring that we actually provide is based on best evidence. But that doesn't mean it's just Cochrane, okay? And so we need to make sure that we are taking into account that there are other ways of knowing. And so how is it that we know that what we do is effective? Are we looking at the state of the research? And that are we okay with talking with our colleagues about evidence-based practice? And but the other piece of it is the environment that we're working in, does it support evidence-based care? There's a lot of different perspectives that we have to look at, and that we want to make sure that we're using evidence-based practice because it does show us that reducing harm to clients or populations is one good way to demonstrate best practice, right? That's what our goal. Our goal is not just to provide only high quality care, but it's also to look at what is the cost of that care as well as the quality, and to provide a good balance between those. We can't necessarily say that this is the only way to do anything because we have to look at the differences between clients. And so nurses are obliged to ensure that the evidence applied to practice is acceptable to the community, right? So an evidence-based culture depends on the use of both qualitative and quantitative research approaches, and recognizing that there's also always going to be different kinds of strategies and things that have worked and that may not be supported in literature on the internet. And the internet may be only one source of evidence that's available to you. So one of the things that we'll talk about with evidence-based care, and we'll be doing an activity specifically about this, is the intervention wheel. And I really like this because it has been absolutely reviewed. It's a grounded theory process, and it identifies core public health nursing functions through identification of 17 very specific interventions and it has been adopted around the world. It's a great opportunity because it outlines the nursing process. Whoops, that's not supposed to be there. It outlines a common set of interventions. There are 17 interventions. They group them by color-coded wedges, and the red, green, and blue wedges are specific to individuals, families, classes, and groups. So they can be the larger focus, but they might be very specific to one-on-one patient care or smaller community level work, whereas the orange and yellow groups are absolutely population, systems, and then the larger communities. Interventions are defined as those actions that are taken on behalf of communities, systems, individuals, and families to improve or protect health status. The intervention wheel has 17 different kinds of interventions, and public health nurses may actually use any or all of the interventions. It really does depend on where they're working. So it starts with surveillance, disease investigation and outreach, um, screening, and then case finding, and then moves into things like case management, delegated functions, health teaching, consultation, counseling, collaboration, coalition building, community organizing, advocacy, social marketing, policy development, and enforcement. Some of this should sound familiar when you think back at assessment, assurance, and policy development as those three core functions. Whoops. All of the interventions are applicable to multiple levels of practice, whether it's individual systems or communities. Um, Except some of them are very specific to population levels. If you're talking about community organization and coalition building, that cannot happen at the individual level. That is absolutely designed to meet the needs of um, populations. However, case finding and outreach and screening, those are individual levels specifically. And so while we might have surveillance at population levels, we're not necessarily going to be looking at all of these. So some of these are very specific to individual and some of them are very specific to population level. And we're going to talk about those and move up through each of the wedges in just a minute. The definition of surveillance is the description and monitoring of health events through the ongoing and systematic collection, analysis, and interpretation of health data in order to plan, implement, and evaluate public health interventions. Disease and other health event investigation systematically gathers and analyzes data regarding threats to the health of populations, ascertains the source of the threat, identifies cases and others at risk, and determines control measures. Outreach locates individuals or populations of interest or populations at risk and provides information about the nature of the concern, what can be done about it, and how services can be obtained. Screening identifies individuals with unrecognized health risk factors or asymptomatic disease conditions in populations. Case finding locates individuals and families with identified risk factors and connects them to resources. Referral and follow-up assists individuals, families, groups, organizations, and/or communities to identify and access necessary resources in order to prevent or resolve problems or concerns. Case management optimizes self-care capabilities of individuals and families, as well as the capacity of systems and communities to then coordinate and provide those services. Delegated functions are direct care tasks that a registered professional nurse will carry out under the authority of a healthcare practitioner as allowed by law. This can include delegated functions that a registered nurse might entrust to other appropriate personnel. So this might be like health aides of some sort, health educators, or but it can also be the professional nurse working under a provider. So health teaching communicates facts, ideas, and skills that change knowledge, attitudes, values, beliefs, behaviors, and practices at the individual, family, systems, or community level. Counseling is the establishment of an interpersonal relationship with a community, system, family, or individual, and it's intended to increase or enhance capacity for self-care and coping. It engages the community, system, family, or individual at an emotional level. Consultation seeks information and generates optional solutions to perceived problems or issues through interactive problem solving. And this again can act at the community, system, family, or individual level. And those levels then select and act on the option that best meets the circumstances. Collaboration commits two or more persons to organizations to achieve a common goal through enhancing the capacity of one or more of those members to promote and protect health. Coalition building promotes and develops alliances among organizations or constituencies for a common purpose, builds linkages, solves problems, enhances local leadership to address health concerns. Community organizing helps community groups to identify common problems or goals, mobilize resources, develop and implement strategies for reaching the goals they collectively have set. Advocacy pleads someone's cause or acts on someone's behalf, but that could someone doesn't it could plead a community cause or act on a community behalf with the focus on developing the capacity of the community system, individual or family to plead their own cause or act on their own behalf. Social marketing uses commercial marketing principles and technologies for programs, which is designed to influence the knowledge, attitudes, values, beliefs, behaviors, and practices of the population of interest. Policy development places health issues on the decision maker's agenda. It acquires a plan of resolution, determines needed resources. It often results in laws, rules, regulations, ordinances, and policies. So this could be, and decision makers doesn't necessarily mean it has to be a lawmaker like the assembly or legislation. It could be policy development committees within an institution. And then policy enforcement is actually the work that compels others to comply with the laws, rules, regulations, ordinances, and policies that were created in conjunction with policy development. So a lot of information there, and it is important that you understand those different interventions, and then we're going to talk about the wedges next. So the red wedge is again, remember we talked about this is often independent and individual, right? We talk about surveillance, disease investigation, outreach, and screening. Those are often paired or can be independent. Screening often follows the surveillance or disease investigation, and screening can also precede outreach activities, so we maximize the number of those at risk who actually do get screened. A lot of times screening actually will then result in case finding, but that can also be carried out independently. And public health nurses use any or all of these intervention. So the green wedge is referral and follow-up, case management, and delegated functions. They're often implemented together in that you identify a case of syphilis and referral and follow-up happens. That might be a delegated function. You might be working with that family or that individual who has syphilis to then, again, follow up, outreach, and do additional screening. So these often sometimes will precede your activities, but also follow those activities. So the red wedge and the green wedge often act together. The blue wedge is often what we are doing as public health nurses in that we're teaching, right? We're teaching, we might be counseling at the individual level or the systems level, or we're consulting. So we might be out there actively teaching people about the issues of smoking. We might be providing counseling, not how do you feel about smoking, but counseling to the legislature about why that's important. So we can often consider counseling an activity that is about providing education that's not teaching, right? Because they already know about it. We're helping them understand how to implement or utilize the information about it for their purpose. And then consultation, maybe we're working in conjunction with another agency or helping them understand the role of public health nursing and smoking and how those two pieces kind of tie together and how do we best improve the situation. So the orange wedge, collaboration, coalition building, community organizing, we group them together because they are types of collective action. They're also those that are carried out at a systems or community level practice. It's not very often that you will do this. I mean, actually, I don't think you ever do this at the individual level, right? So we're really talking about getting out there and, as a nurse working with the March of Dimes, I might actually be also working with the Children's Hospital and then working to organize an event in the community to help bring people together. So we look at decreasing alcohol and children who are born with disabilities. And then, of course, the yellow wedge, they're very much interrelated. Um, Sometimes advocacy precedes your policy development work. Social marketing is often seen as a way of carrying out advocacy. So we might be getting out there and trying to advocate for vulnerable populations because they're more at risk for opiate use, alcohol use, tobacco use, and then we use social marketing to target those populations or those people who need to know, and that we then in turn use the information from these vulnerable populations to then look at how do we develop policy and then of course enforce it.